Great, Bruce. Thank you so much for that excellent summary, and welcome to everybody. My name is Robin McKinnon. I'm a Senior Advisor for Nutrition Policy at FDA's Center for Food Safety and Applied Nutrition. And as Bruce just mentioned, today's session is going to be looking at the challenges and the opportunities for implementing precision and personalized nutrition interventions. We have 6 presentations followed by a panel discussion. Please type your questions into the chat box during the presentations, and we'll share them with the speakers during the Q&A at the end. Full bios for all of our speakers today can be found on the website. Before we start, I'd like to channel my former physical activity colleagues at the NIH, CDC, and Active Living Research, and invite everybody who's joining today to reduce sedentary time where appropriate. If you're mostly seated, you might stand on occasion, maybe do some light stretching or activity, and you might use the changeover between speakers as a reminder for that. And with that, I would like to introduce our first speaker, Christina Roberto. Dr. Roberto is the Mitchell J. Blute and Margot Crody Blute Presidential Associate Professor of Health Policy at the Perelman School of Medicine at the University of Pennsylvania. She's also the Director of the Psychology of Eating and Consumer Health Lab, the PEACH Lab, and Associate Director of the Center for Health Incentives and Behavioral Economics at Penn. Dr. Roberto, over to you.
Thank you so much, Robin. Let me just share my screen here. So I'm really delighted to be able to talk with this group today. So the question that's motivating my talk that I've been grappling with is, will precision nutrition help us achieve greater health equity? And I have no conflicts to disclose. So as I'm thinking about this question, here's where I'm at. I think for me, maybe, but I'm skeptical. And I'll just highlight in this talk some of those challenges. Now, I'm not an expert on precision nutrition. I think a lot about how the environment influences food choices people make, and I study policies that try to promote healthy eating. And I think this field is fascinating and needs to be studied, and there's a lot of potential. So although I'll sort of play a skeptic here, I'm very curious to learn, and I'm hoping others too will advance, some of the positives and counter some of the issues that I'll raise. So there's many definitions to precision nutrition, and I'm just pulling one from this JAMA Viewpoint by Rogers and Collins, where they're outlining the NIH's strategy around precision nutrition. And, they highlight the reason that we're all convened here for these 3 days. Like, this has tremendous excitement and opportunity. We know people have these different disease risks and biological responses to diet. It's really appealing to be able to give tailored nutrition advice. And the goal of precision nutrition is to really kind of look at all these individual level forces and these more systems, as Bruce was just saying, kind of system level forces and how they come together. And I've highlighted in red those system level forces. Those are the ones that I tend to focus on. And I think what's exciting about this particular event is a lot of what I've seen around precision nutrition has been really focused on the individual level, the genomics and the microbiome. I think this event is neat because we are trying to scale up a bit and think about, well, how that interacts with a lot of really key drivers of food choice: neighborhood and community context, economic and social policies, political systems, corporations, social norms. And so we want to be thinking, really at a very broad level when we're talking about food choices. And so I'll raise some of those higher level issues today. These maps have come to be very famous. I'm sure many of you have seen it before. I currently live in Philadelphia, and this, designed by the Robert Wood Johnson Foundation and others, has highlighted the kind of difference in life expectancy that you can see by zip code. So in Philly, we've got a 20-year difference between, say, where I live in Center City, which is a fairly affluent part of the city, versus North Philly, where it's predominantly a black and brown community, very low income, and you see these massive gaps. Now, that's not all diet driven. There are a lot of factors and forces there, but certainly nutrition-related chronic diseases are disproportionately impacting people in that neighborhood. Go to New Orleans, you can find a 25-year difference. So I am thinking, well, is precision nutrition going to fix that? And Probably not, but maybe. And I do think there are certain groups for whom there could be amazing, scientific advances that can really help. And I don't want to minimize that. But the question I'm grappling with is, on this broader population level, when we look at the distribution of chronic diseases and we see it's more distributed in low-income communities and Black and Brown communities, I want to make sure the field of precision nutrition is grappling with that. And, as Bruce said, and there's been conversations already, how do we not widen disparities? So we really have this vicious cycle of unhealthy dietary habits where you have these environmental drivers that I was just talking about that exploit a whole host of vulnerabilities. Some of them, are biological, and we spent a lot of time on that. I'll talk a little bit about some of our psychological vulnerabilities. Of course, we have these social and economic vulnerabilities that get exploited by current unhealthy food environments. That leads to overconsumption and then increased preference and demand for unhealthy foods. And so you really get a cycle that can be very hard to break. Okay, so I'll just throw out a few reasons why I'm a little bit skeptical. So we know that 60% of US adults have a diet-related chronic disease. It's really high. We also know that people really have difficulty adhering to dietary guidelines, even when there's simple messages like eat more fruits and vegetables, and when those messages have been consistent for decades. I don't know that more targeted advice is going to fix that. So I think it's important to not fall into the trap if people just knew more, then they would eat better differently, right? So knowledge is not the only barrier, it's often not the main barrier. And adhering to dietary advice gets even more complicated when you're trying to adhere to like a disease-specific diet, like for type 2 diabetes. Here's some data just looking at from the dietary guidelines on adherence of the US population to the guidelines over time. That score on the y-axis of 100 would mean people were meeting the guidelines, were exceeding them. And you can see we're far from that. And also we've gone up a bit, but it's pretty stable. This is the healthy eating index, which indicates diet quality. So this hasn't been something that we've very successfully moved over time. So I want to talk a little bit, and this gets into the psychology of eating, of why it's hard to communicate nutrition messages to the public and to change behavior. And we'll start with some very basic psychology. So memory is limited, and unfortunately, information processing is really effortful. This is a very famous, I'm sure well-known to most in this audience, kind of depiction of the basic psychology of how we think and make decisions and make judgments. So psychologists tend to think about two systems, system 1 and system 2. Most of our food decisions are made with system 1. These are the kinds of decisions we make that are fast, automatic, effortless. We use associations, we use emotions to make decisions. But sometimes we engage in system 2. That's the more kind of slow, controlled, effortful type of reasoning or logic. But, when you're at the grocery store, when you're deciding what to eat at a restaurant, often we're relying on system 1. And so I'm going to share just kind of one quick study by my colleagues, Rebecca Ratner and Jason Reese, to sort of illustrate the limits, humans' limitations around nutrition messaging and implementing it. And they have this great paper about memorable and actionable guidelines. And they were actually studying the 2005 food pyramid. We've obviously come a long way since there, but studying this as a communication tool. And what they were doing in their research is they looked at the personalized guideline that the My Pyramid plan created at the time. You could go on the website and get some very specific recommendations for what to eat. And they were trying to figure out, is this easy to remember? Is it motivating for people? And what they wanted to do was compare it to a simpler version called half plate, which is not as precise. It's just giving a simple message, fill half your plate with fruits and vegetables, and compare it to this more personalized message. So they did, I'll show you just two quick studies. They had, 86 or so people come to the lab and they assessed motivation to follow nutritional guidelines. They got randomized to one of these two messages. And then they just had them open-ended, try to recall what they just saw, and then ask them how motivated they were to follow this guideline. So this is the percentage with perfect immediate recall after they saw the half plate message and the My Pyramid message. So 85% can remember half plate, 19% can remember My Pyramid. They just saw it, so this is immediate recall. And in terms of being motivated to follow this, so you'll see in this graph, the high motivated people, so at baseline, they're motivated to follow nutrition information. They're pretty motivated to follow half plate. And you can see they're far less motivated to kind of act on the My Pyramid personalized guidelines. And I'll just share one more quick study. So they repeated this same procedure, measure motivation, randomize people. They wait a month, and then they ask them to make some decisions about what they want for dinner. So they have to choose 6 servings from a series of different food options offered to them. And here's the number of fruits and vegetables chosen. So when people were exposed to half plate and then asked to make choices a month later, you can see the high motivated people had on average 2.9 fruits and vegetables chosen. In My Pyramid, it was less, but you can notice actually across the two, motivation really matters. So these guidelines are already mainly impacting people who are already motivated to make healthy choices. And then there's some advantage for half plate. And then this is the percentage correctly recalling the amounts after 1 month. In half plate, 62% can correctly recall that guideline or what it said. For that personalized guideline, it was 0.7%. Okay, so we've obviously come a long way. We have tried to have more simple guidelines. We're going to talk about dietary guidelines a bit more later, but I'm using this just to illustrate the importance of simplicity and the challenges we have when trying to rely on just memory. Now, obviously, you might say, well, we've got all sorts of technologies that are going to remind people and show them, so they don't have to rely on memory. But I think as we've already explored in the workshop, who's using these kinds of health apps? So these are some data from a nationally representative sample from the NCI Health Information National Trend Survey on mobile device use and health app use. And I think we've already touched on this a bit, but just to remind people, it tends to be folks who are younger, women, and who are higher educated. So from my perspective, I do worry in terms of increasing disparities and who's likely to kind of take up this precision nutrition movement. Also, the other challenge that I'm worried about is this being exploited for profit. Now, we already see this. Nutrition research will say, look, we need to eat more fiber. Fruits and vegetables are good for us. Well, then what often happens is you might get a sugary drink like Capri Sun, which, toddlers and small kids really should minimize their consumption of or avoid altogether, but they've got tons of claims on them. Good source of fiber, highlighting the fruits and vegetables in it, a good source of antioxidant. And so I think we just want to take care that this field doesn't, go down the same road of exploiting that. And finally, and I'll be wrapping up, I think online shopping could be a really cool opportunity. Now, this is a snapshot of Amazon. And they're already, doing a lot of this. You can shop by your diet, your keto, organic. But I think what we're seeing a lot of is, data being sold, very personalized, targeted marketing, which could have some benefits. But if people are in general not eating terribly healthy, and a lot of that marketing is for unhealthy foods, I think it could just exacerbate the problem, especially now that we're seeing SNAP being accepted online. More targeted marketing isn't necessarily a good thing. So I'm going to end by just kind of reminding us, Shiriki Kumanika, a really wonderful scholar who's thought a lot about equity-oriented work, has this Getting to Health Equity framework that I think we want to be sure is incorporated into the conversation around precision nutrition. And, part of this framework are things we've talked about for a long time that focus on the food environment, increasing healthy options for people, reducing the amount of unhealthy marketing, but also thinking about broader social forces, economic development, education and job training, housing subsidies, empowering communities, promoting entrepreneurship in Black and Brown communities, things that are really broad that are likely to move the needle on these really entrenched, difficult problems. And so I'm hoping the field will do more around that. And then the last point I'll make is, I think we want to be mindful to not have this disconnect between nutrition science and most humans. And I say that coming from the perspective of having previously done clinical work and doing behavioral weight loss treatments, and looking at food records with patients. And, on the one hand, we've got this very tailored specific advice. And on the other hand, I'm sitting across from a patient who's putting sugar in his soda, and we're working on trying to do that less. And so I think meeting people where they are and recognizing that we have this cool technology and all this promise, but we want to make sure, those sort of with the fewest resources are kind of supported, and we're meeting them where we are, and we're working on the changes that they're going to need to make to be healthy. So I will end there with some contact information, and I'm looking forward to the other talks. Thanks for listening.
Great. Thank you so much, Christina.